Dr. Lerato Khatle is a founder of Young MD. She is a community service doctor serving in rural Northwest. She's determined to use innovation to empower its generation of doctors and healthcare workers to no longer be victims of a challenging healthcare system, but pioneers of its transformation. Let's chat to Dr. Lerato right now from our Durban studios. Thanks very much for joining us and welcome to the program.
Thank you for having me, Peter.
All right, so this conference is right up your alley. You're young, you're intelligent, and you understand how technology can be embraced to do amazing things. Tell us about some of the things that you're trying to bring technology to your medical world.
Thank you so much for the opportunity. So my company name is Young Medical Doctor, and what we are is a health innovation and health management solutions company. So we aim to use innovation as a tool to innovate for both the human resource as well as the systems in which they operate to provide a healthcare service. Our pain point to what we look at is a public healthcare service, and we really are trying to address the retainment of the resource of the doctor and every other healthcare workforce in the healthcare sector. And in the advent of the NHI, which is coming up, it's so important to solidify that healthcare workforce. What we provide is solutions such as an app, which is currently at concept phase, but we were looking, that is why we were at the ITU conference, to be able to partner with people who build apps and can help us bring this to the fore. In the meantime, though, we've established a good consumer base with doctors as well as partners like hospitals. We've got an orientation platform that's up and running on our website where young doctors are able to engage with the orientation tools available for their hospital. It's currently piloted at Helen Joseph Hospital in Johannesburg, and a mentorship tool where we have mentors helping junior doctors who enter into the system be empowered to not just be clinically sound but operationally excellent. And that's what we're looking to continue to do as we grow and develop.
All right, you talk about operationally excellent. So I'm in the Northwest Province, in the rural areas. I'm Colin Limawani, and I'm wondering, how is my life going to change with doctors being empowered in this way?
This is such an important question because this is really the pain point of Young MD, is having doctors who don't enjoy serving in any part of the public sector is a problem. At the moment, the only way we retain the resource of the doctor is to have compulsory phases of service like internship and community service. And although those are beneficial, that doesn't mean you have consistent presence of the healthcare worker or the doctor in the space. And how it's going to help those people is make sure that doctors have access to those spaces. So we have incredible pipeline options that we're thinking of making sure that a doctor at every level can encounter their patients. It's also beneficial for the patients because the service that the doctor provides is far more efficient. We empower the doctor to enjoy the experience of serving in the public healthcare and give them the tools to know that they are able to innovate in the space and find their place, whether they're in the public sector or even in the private sector. So we're really hoping to challenge the South African doctors and also healthcare workers to dare to be great. And like we said, not be victims of this challenging healthcare system, but pioneer its transformation, because that's where we are needed.
All right, so give me a good example of one application or one element of that application that's a game changer for you.
So I think what's a game changer for us is digitizing ward work tools for doctors. So enabling the doctor to engage in ward work activities from the patient bedside, from their phone. And obviously at conceptual phase, quite a few things are not yet solidified, but we're excited to partner with people who know how to get these into a space. What we're aware of is where the doctor and we understand the problem. And I think it's so important for doctors to come to the fore and start addressing the issues they feel need to be addressed so that they can work effectively in this space. And that's what's a game changer for us, is having the ability to do ward work on an app and just be interactive in that space. And also I think mentorship opportunities, just knowing that as you continue on in the ranks in healthcare, you can establish your place by knowing and being surrounded by people who've done it before you, but continue to innovate in that space.
All right, and how did you develop these innovations? It sounds almost like you were in a lot of pain and you thought, I need a solution.
Yes. So my story is quite interesting. I was very excited to start the journey of becoming a medical doctor, and at my internship facility I really did expect someone to orientate me, and that never happened. And as my journey continued, I kept encountering doctors who just felt so disappointed and dissatisfied at their experience of being a medical doctor. And although that's something doctors don't speak about often, it is a really common shared experience. But then again, from the user's perspective, a lot of patients have a lot of grievances about how they experience healthcare services. And so I just felt and thought of the day that I might have to answer to maybe my children one day and and answer the question, would I allow them to be a medical doctor? And at the moment, my answer was no, but I thought it's so important for us to be a generation that's accountable for our time. And I don't want that answer to be no, I want it to be yes. So I was inspired by my frustrations, and I allowed them to be a tool to help me see this as a space that we can change, that we can develop, and we can grow. And I want my entire generation to join me in this cause to make sure we provide South Africans with the healthcare they deserve, but we become the doctors we've dreamt of, because we know the statistics. 84% of the population uses the public healthcare sector, and we know we are needed there, but we need to start to make this an environment that's conducive for us to serve.
Well, we wish you the very best of luck, and sounds like a fabulous app. Let's hope it gains traction. Thanks so much for bringing it to our attention. All right, that was Dr. Lerato Khatle, who's the founder of Young Medical Doctor. Interesting app that she's got to try and encourage doctors, particularly those working in far-flung places, to stay in the profession and do the best that they can.